When Beaumont Health System breast surgeon Dr. Nina Deckney saw a 20-year-old patient was scheduled to talk to her about a double mastectomy, she immediately started asking questions.
I said, why am I seeing this patient for a mastectomy? You're essentially wasting my time. I would not recommend a mastectomy in a 20-year-old.
But she just walked in and she said, Kelly, I don't know why you're here. Never in a million years would I do a mastectomy on a 20-year-old.
Even going in, my thought was, I'm going to go talk her out of this. I don't care how determined she is to have this done. And I walked in the door and, she introduced herself and she told me who her mom was. And right then I knew where she was coming from.
I think she realized that I was educated enough to make the right decision. I knew the risks, I knew all my facts and my statistics, and I still decided to do this.
Kelly's mother and aunt carried the BRCA gene mutation. Breast cancer took both of their lives. At the age of 18, a genetic test confirmed Kelly also carries the gene mutation. Doctors told her she has an 87% chance of getting breast cancer. Dr. Dana Zakalik delivered the results to Kelly and her father.
I think what was really truly the hardest was the day that we had to disclose that she indeed is positive. I think it was hard for all of us to keep from crying, frankly, knowing the impact of this, and no matter how optimistic I am and was about presenting this information, I think the reality, this made everything fresh again.
Dr. Zakalik also treated Kelly's mother, Nancy.
She was a remarkable woman. I remember her well because she was battling breast cancer at the same time that she was taking care of little kids and running 10 miles a day and taking care of the family, and was a real inspirational individual.
Kelly was just 9 years old when her mother passed away.
I know that Nancy would be very, very proud of her, and she has every right to be.
I didn't care enough about my boobs to keep them. I cared more about my future to get rid of them.
Oh, I know what my wife would say, is she would be doing the exact same thing that Kelly is. She is so much like her. It's uncanny.
And I had my surgery in the same building my mother had her surgeries, a lot of them, so chances are she had been in that operating room too.
Kelly also chose to share her story with the media and even a film documentary crew.
I had the opportunity to teach people about this gene and about, preventative measures and the steps to take and what's going on, and just, make it really personal to them. Have someone that they can look to other than Angelina Jolie.
And she's tried to empower others. She's made it her personal mission to sort of get the message out that, this is an important thing for her.
Now that the surgery is over and Kelly is recovering, she feels even more confident about her decision.
I made the choice to save my life. How can anyone ever regret that?
But Kelly and her doctors warn having this kind of preventative procedure isn't for everyone.
Physically, it's not a difficult surgery to recover from. Emotionally, it is a big deal. The reconstructed breasts might look like augmentations, they look like implants, they look good, but to the patients themselves, they don't feel like natural breasts at all. And this is one thing I stress over and over again and let the patients know. The reconstructed breasts are insensitive. When you touch them, when you feel them, the patients don't feel it.
I can be used for inspiration to get tested, but I don't want to be anyone's excuse for doing this so young.